these symptoms. There's 7 of them. Okay. Number 1, pale skin. Now, why would you experience pale skin? Well, because you're not able to make red blood cells and you're not getting the oxygen. And so your body is starving of oxygen and you're looking a rather pale, like you would see in someone that's anemic. Now, sometimes your skin might be a little yellow or jaundice because the red blood cells are fragile and the byproducts can then create that appearance. All right, number 2, you're going to feel constant fatigue, weak. You're always going to be sleepy and drowsy no matter how much you try to get some sleep. That is because without oxygen, your metabolism can't work. You're just going to be always tired. All right, number 3, mouth problems. You may have ulcers in your mouth. You may have a shiny, swollen, red tongue. Why? Because the tongue is not able to get oxygen and it's swelling up. All right, number 4, cognitive issues. So without B12, you can be very, very depressed, severely depressed. You can have anxiety. You can have memory problems. You can have paranoia. You can be delusional. Your thinking really gets thrown off if you don't have enough B12 because both the brain and the nervous system need B12. When the brain doesn't get oxygen, it just cannot work. All right, number 5, and this does relate to the cognitive function, but nerves, okay? If you're deficient in B12, you're not going to be able to make myelin. Myelin is the coating around the nerves, like I talked about. And so if you can't make this myelin, you're going to start getting a short-circuiting problem in the nervous system. And that's going to show up as peripheral neuropathy. Now, what's the definition of peripheral? Well, the outer edges of something, right? And neuropathy, nerve, pathy means disorder. So it's a disorder of the nerve on the outer edges of your body, like your toes or the bottom of your feet or your fingertips. In practice, I've usually noticed that it was mainly in the feet, not the hands, but it can occur in the hands. So we have peripheral neuropathy. Now, if you're very severely deficient in B12, you can experience irreversible nerve damage and you can be in severe pain. I mean, it's really, really bad because it's irreversible. So what are you going to do? So this is why I'm doing this video, so you can catch it before it creates irreversible nerve damage. I mean, in practice, I had a guy come in with this problem, okay? It was so bad. He really wanted to commit suicide because it got to the point where he just couldn't get rid of the pain. And so now he basically is forced to live on medication permanently, which is terrible. All right, number 6, blurred vision. Why? Because what helps you see is the retina. The retina is neurological tissue that is in your eye, and it goes directly back into your brain. And if that's affected, you're not going to be able to see that well. So one symptom would be noticing that your vision is worsening and you need glasses for no reason. Suspect a potential B12 deficiency. All right, and the last symptom would be a fast pulse rate. Now, why would the heart start increasing its beats? Well, that is because you can't make red blood cells. So that means you're not going to have oxygen, and the body has to compensate for a lack of oxygen by increasing the rate or speed at which your heart pushes blood through the body. So anyway, I just really wanted to increase your awareness on B12. Now that you understand B12, I think